So South African health officials say they are investigating a recent surge in coronavirus cases among younger age groups, something that was not seen with the previous waves of the pandemic. It comes as South Africa is battling a fourth wave fueled by this Omicron variant. For more on the latest data trends, we're joined by the South African Medical Research Council's director, Dr. Fareed Abdullah. Dr. Abdullah, very good evening to you. Thank you so much for being on News at Prime. So the concern at this stage, as ever, when we see a peak in infections, is keeping people out of hospital. What has been your analysis, your assessment of the data around hospitalizations? Are you still seeing more?
Tembegile, over the last 2 weeks, we have seen a large increase in hospital admissions, and there was no doubt in our mind now that the fourth wave is here. The South African public needs to be very, very aware of this. If they get infected, there is a chance they will end up in the hospital, and everybody wants to avoid that. But the wave is here, and the danger is here.
And for those who are admitted to hospital, doctor, what symptoms are they showing that leads to hospitalization?
So what's interesting this time around, and we want to be cautiously optimistic about it, is that most of the patients in the hospital are what we are calling incidental COVID. That means they are in the hospital for another reason, a medical reason or a surgical reason, and the COVID is an incidental finding. So 2/3 of our patients at the Steve Biko Tshwane District Hospital over the last 2 weeks are there for another diagnosis. That's unusual. That's different from previous waves.
At this early stage, and I say early stage because a lot of data gathering is still going on around Omicron and how it behaves, is it still too soon to say it's milder? Because that appears to be the assessment, at least from people who've been sick in the last week or so.
Yeah, it's too soon to say it's milder, but let's just break this down, Tembegile. When we say if we want to assess severity, does it mean that of all the people who get infected, there will be fewer people who get into the hospital? The only way to get that result is through vaccinations. And we are seeing that probably in the older age group. More vaccinated people, fewer older people getting up into the hospital. So we have seen a change in the profile of patients in our hospital. Of the 166 patients we've admitted in the last 2 weeks, I can tell you 80% are below the age of 50, and most of them are unvaccinated.
So it was interesting to read research at the end of last week, initial research that said with Omicron, what we're seeing now is a threefold chance of reinfection. And you talk about low vaccination rates. People who, for example, were sick early in 2020, as well as early this year and around winter and the third wave, are saying, well, I beat those three and therefore should be fine. Why are you forcing me to get vaccinated? How do you respond to that?
So I think we all accept that vaccinations are not 100% protective. People who are vaccinated are getting infected. But I can tell you that if you are vaccinated, the likelihood of ending up in hospital, or if you are in hospital, the likelihood of getting severe COVID is much lower. So let me use a simple statistic. Of 42 patients in the hospital on Thursday last week, which is when I was in the ward, there were 9 patients with severe COVID pneumonia. All 9 patients were unvaccinated.
And in that case, then, do you find, whenever you go through international media, you find a lot of people who give interviews, bedside interviews, who say, well, I didn't want to get vaccinated, but now that I'm here, I wish I had. Are you finding a lot of that?
Yes, well, that's definitely. What I did during the week is I went and talked to each one of the patients in the 2 general wards, and I can tell you that a number of patients, when I said, are you going to get vaccinated now after you get out of the hospital? They said, I should have gotten vaccinated. I might not have been here. But in addition to that, there were 2 patients specifically that I spoke to. They were older patients, and, they had mild COVID. They were sick from some other illness, heart disease or diabetes, the 2 I'm talking about. And I said to them, did you get vaccinated? They said, yes. And I said, well done. if you were not vaccinated, you would have your horrible diabetes, but you would also have a horrible COVID pneumonia. So a lot of people who were vaccinated ending up in hospital with a severe illness are grateful that they're vaccinated, and a lot of people who are unvaccinated with COVID pneumonia thinking, damn, I should have gotten my vaccination. I wouldn't be here.
What then, Dr. Abdullah, about the people, and we've seen a bit of an increase in the uptake of vaccines, right? So people clearly either hearing the messages from the likes of yourself as healthcare workers, or in some cases spurred on by the recent increase in the number of infections. Is it not too late to take the shot in the middle of a wave?
No, absolutely not. You know, this wave, the last wave lasted 5 months. And also after the wave ended, we still had patients being admitted for COVID. The wave doesn't disappear completely. You still have a residual number of infections after a wave. We don't fully understand why we get these waves, right? It just comes high, goes down, but it never goes down to zero. So no, if you're not vaccinated, vaccinate today, because if you get infected 2 weeks or 3 weeks or 4 weeks from now, your vaccination will save your life.
To what extent do you think, if at all, the limited data that's available on Omicron perhaps compromises or limits the ability to formulate a properly comprehensive public health response at this time?
I don't think we must change our strategy too much. Basically, we have entered a fourth wave. We need to make sure that our hospitals are able to prepare for the deluge of patients that are coming. We need to make sure that the hospitals have got PPE, they've got the equipment they need, they've got the nurses and the doctors. So I don't think this kind of confusion about whether Omicron causes mild or severe disease or less severe disease should confuse us at all. In previous waves, Thembekile, you remember, a lot of patients couldn't get a hospital bed, right? So, you know, if we have a situation where there's fewer cases converting to hospital admissions, I can tell you it just means that more people will get into that hospital, and that's a good thing.
And Dr. Abdullah, on another issue, as the South African Medical Research Council, you have since the beginning of the pandemic been collating data around COVID-19 related deaths. I understand there's been a pause in your ability to access those numbers. Why has there been a pause, and how soon do you expect you'll be able to resume?
No, Thembekile, I'm not really directly involved in the collection of that data. It's fantastic data, and I'm sure that the pauses will be resolved. If there is a reluctance on the part of anyone to continue providing that data to Professor Debbie Matthews, who's been doing this work for 20 years, I can assure you that measuring excess death is our only true measure of the damage, the impact that COVID-19 has caused on South Africa.
Dr. Fareed Abdullah, thank you very much, sir, for your time tonight. A pleasure to speak to you. Thank you. Dr. Abdullah is the director of the South African Medical Research Council, speaking to us tonight on News at Prime. You see